So I'm a pediatric radiologist and the CEO of Envisionit Deep AI. I have 20 years of experience working in public hospitals, and I've also participated in outreach efforts throughout Africa. In 2010, I became the first South African trained pediatric radiologist, and it's now 2020, and I'm still one of 20 pediatric radiologists on the continent. And the continent that is the youngest in the world, where more than half of the population is under the age of 15. So through the years and through my experience, I knew I was making a difference by training more pediatric radiologists. But I realized that with just human capacity alone, we cannot solve some of the challenges. And I knew technology can be transformative. That's what actually started Envisionit Deep AI. So what we've done is that we leverage the use of machine learning and the expertise of radiologists, and we created a platform called Radify. Now, Radify for chest X-rays was developed because pneumonia is the #1 cause of morbidity and mortality in children under the age of 5 in Africa. I mean, it makes no sense, right? It's one of these diseases that is so easy to treat. And so we created the solution for pediatrics and for children, and we've adapted it to adults so it can detect 20 different other pathologies, including COVID pneumonia. So during the time of this pandemic, we were able to repurpose our chest model, and we were able to train it on patients who actually have COVID pneumonia. And it now prioritizes cases that have a high suspicion of COVID pneumonia into a high probability, intermediate, and low probability. And we were able to implement this solution in 2 academic tertiary institutions. In fact, one of the hospitals is a hospital in the Northern Cape with only 1 radiologist. It's a 700-bed hospital. And the doctors are using it to help to prioritize cases that have a high suspicion of COVID pneumonia. I realized through the years and through my experience that we can use technology where it can be transformative. And with artificial intelligence, I can use it to augment and multiply my role. Instead of training 1 pediatric radiologist a year, this is where AI can augment and empower doctors. I think as Africans, and specifically as South Africans, we know our problems more than anyone, right? And we can provide solutions to these problems. And what again is so unique about us is that we have the resilience and the tenacity to overcome a lot of these challenges that we face with really innovative solutions. We as South Africans are so bold in our vision. For instance, our company, our vision is to democratize diagnostic healthcare for Africa. But we realized through the challenges we face, and especially during this COVID pandemic, that this challenge is a global issue. And yes, we can cross borders with our solution, and we can apply and adapt our solution anywhere else in the world. So funding would be required in order for us to be able to build more solutions, as well as for us to scale our solutions, and collaborating with other countries would be mutually beneficial. I think investors must look at us as entrepreneurs, not just as the country, the entrepreneurs that make up this country. I am passionate about children, the health of children, and working with children. That is why I specialized in pediatric radiology. Apart from being the pediatric radiologist, the doctor, the entrepreneur, I'm a mom of 3 girls, and I'm raising 3 warrior girls. And it's so important for me to set a good example to them. What makes me who I am, I think, has a lot to do with my upbringing, the challenges I've faced, and how I was able to deal with these challenges, and gives me that drive and foundation to just strive to be a better person. I am so proud to be a South African. We are so diverse. We have the talent, we have the perseverance, we have the tenacity, and most of all, as South Africans, we have the resilience.